How does Medicare coordinate benefits with COBRA coverage? Imagine switching from one health plan to another and wondering which one pays first. That's what we're exploring today, how Medicare and COBRA work together when it comes to paying for your health care. When you lose your job and choose COBRA, you get to keep your employer's health plan for a limited time. But if you are already enrolled in Medicare before losing your job, Medicare pays first for covered services. This means Medicare is your primary insurance, and COBRA acts as a backup. COBRA then helps cover costs Medicare doesn't pay, like co-payments or deductibles. It's important to keep your Medicare COBRA active in this case because without it, you'd lose your main source of coverage. If you sign up for COBRA first and later become eligible for Medicare, your COBRA coverage usually ends once you enroll in Medicare. This is because Medicare is designed to be your main insurance after you qualify. You have an 8-month window after losing your job or employer coverage to sign up for Medicare without facing penalties. Missing this window can lead to late enrollment fees and gaps in your coverage. Now, if you are working past 65 and still have employer coverage, that employer plan is typically the primary payer. Medicare then acts as secondary. But once you leave that job and elect COBRA, Medicare becomes your main coverage, and COBRA helps cover remaining costs. There are some tricky situations too. If you sign up for Medicare Part A, which covers hospital stays, but delay Part B, which covers doctor visits and outpatient services, some COBRA plans might try to recover payments for services Medicare Part B would have covered. This can leave gaps in your coverage, so it's wise to understand how your specific COBRA plan works with Medicare Parts A and B. In summary, when you have both Medicare and COBRA, Medicare usually pays first unless you are still employed and covered by your employer plan. COBRA is a temporary extension that ends when Medicare begins, so keeping your Medicare active is key for continuous coverage. Deciding whether to keep COBRA after becoming eligible for Medicare depends on your needs and costs, but always remember Medicare should be your primary insurance once you qualify.